You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
This is the Pain Pod.
You want to see pain? Look at these.
Welcome to the Pain Pod, the podcast for all things pain management. Hosted by the Pain Guy, Dr. Mark Garofoli. We'll be collaborating with numerous pain management experts, talking about substance usage disorders, the latest treatment modalities, and most important, focusing on the pain of our patients as leading providers of pain care. And now, here's our host, a man wanted in all 50 states, a suburban city-like mountain man,
Without the beard.
from the hills of West Virginia, and certified in weapons of mass destruction response. It's Dr. Mark Garofoli.
All right, welcome back, Pain Pod Nation. We got another good one for you here today. So it's not just yours truly on the mic today. We've got a guest, quite the guest actually. Hey, it's the Pain Pod. We aim for the top, right? And in this case, we're going to be going over sports pharmacy, okay? And, by far, most folks are into some sort of sport here and there, right? We've got the Olympics eventually coming up, right? That's, you could say that every, 2 years pretty much, right? But we actually have pharmacists tied to that now. There's pharmacists working in sports all across the globe for that matter. And we're not just talking like youth baseball volunteering or anything. We're talking like part of the team. You're getting the Super Bowl ring. You're right there with the Olympic team, you name it. A friend, I'd even give the shout out to Robert Nickel. He's connected this here pain guy with many of folks. One of them, illustrious stars, is going to be here today, of course. But the overall idea here, we're going to have Brandon Welch joining us. And that brings up the overall idea here for sports medicine overall, sports pharmacy, where the overlap hits. I mentioned that whole youth sports thing. It's not necessarily that, folks. Although I highly encourage anyone listening to volunteer in their communities. You're hearing from an assistant to the regional youth baseball coach for our oldest son, right? But you know what? Even with the little kiddos running around the bases, hopefully you go to first base first, not third. That's usually the T-ball goal. Pain happens, right? We don't want that for our kiddos, but it happens. My oldest son's team a couple years ago, first game of the year, a pitcher took a baseball right off the skull. He was fine. Okay, he was fine in the end. Luckily it wasn't an MLB batter, but these things are going to happen. But it's all on how you react to it along the way. We had the proper folks checking things out. So, in that realm here of the overlap with sports. Let's see, we welcome Dr. Brandon Welch, also known as the Pharmacy Athlete. He's nationally recognized clinical sports pharmacist and co-founder of the Sports Pharmacy Network. So Brandon, I certainly want to personally welcome you here to the Pain Pod. You've been around the block, you've collaborated with so very many in the realm of sports pharmacy, and beyond that, of course, too. But, for those out there that may not have come to know you yet, what's your story, bud?
Yeah, of course. So first off, Mark, thanks a lot for having me on the podcast. Honored to be here to share my story. And, to answer your question, I've always been actively involved as an athlete growing up. I remember very vividly my mother taking my brother and I to the Dolphins training camp to watch the players train. It's crazy. I even have a picture of Don Shula and I when I was like 6 years old. And to fast forward and to see me working with the Miami Dolphins is a pretty impressive and humble story. And
to say the least.
Right.
Full disclosure, folks, I'm a Miami Dolphins fan, so just throwing that out there for you.
And I used to go to the Lonzo Morning, Summer Groove, and the basketball training camps. I mean, I even played AAU basketball growing up in high school. And along the way through college, I met a few mentors who got me into pharmacy. And to make a long story short, throughout my pharmacy curriculum, I've always had a passion for biochemistry and physiology. So those were always the classes I was really locked into, and a little bit of pharmacokinetics. And all this will make sense as I kind of dive into, my role and responsibilities as a sports pharmacist. And after graduating from pharmacy school, I went to the University of South Florida. Shout out, Go Bulls. I ended up working in retail for a few years. And specifically, what really started the launch to my career as a sports pharmacist, believe it or not, was when I was a pharmacy manager at Costco. And so I managed the Costco in Naples, Florida. And for anybody who knows Naples, Florida, there's a lot of weekend warriors, pickleball players, which pickleball is growing
Everywhere.
Yeah, everywhere. Right. And, a lot of my work I felt as a pharmacy manager for Costco was in front of the counter, not behind it. And so I had a lot of these weekend warriors, fitness enthusiasts, pickleball players coming to me, asking me about different sports supplements to take to help optimize their game on the court. I mean, look, these guys are highly competitive. So they really challenged my mind, and they came in very well educated. And Mark, it was from that moment there, I had an aha moment from when I was a child and thinking about, the sports experience I had. And then I just started literally going down a rabbit hole, to say the least, to figure out how to intersect, my expertise in pharmacy with my passion in sports. And so, later after that, I ended up going back to school. I went to the University of Florida to get my master's degree in kinesiology and physiology with a concentration in human performance. And throughout that curriculum at UF, I started writing blogs, especially from when I took an ergogenics aids class at UF. And I started writing blogs around ergogenic aids, around evidence-based supplements on LinkedIn. And then I started my brand, The Pharmacy Athlete. And, it was just a matter of time, God kind of leading me in the right direction. And little did I know is that there were folks over at Baptist, following me on LinkedIn and being quite amazed with some of the content that I was putting out there. Mm-hmm. And it started the creation of this role of a pharmacist working in the sports medicine clinic. So essentially, I was able to get recruited, right? And, I think about this always, how I was going down this path of having a blank canvas and trying to map out and draw, okay, how does this make sense of a pharmacist working in sports medicine? What value proposition does it have? What impact can it bring to those patient athletes? And, through working in the sports medicine clinic, it's really allowed me to carve out and identify opportunities for pharmacists to really work with athletes, especially at a high level, without trying to make it seem like, okay, you're this rogue or siloed pharmacist, but no, to be a complementary piece to the sports medicine healthcare team. And so that's the sports medicine physician, that's the athletic trainer, physical therapist, sports dietitian, and figure out, okay, what is your role when you're a part of this healthcare team to optimize an athlete's care? And that is, being able to educate on performance enhancing supplements, the ones that are legal versus the one that's illegal, really understanding the kinetics of different pain medications, which I'm sure we'll get into later, Mark. And, really tapping into your clinical toolbox, to say the least. And, the rest has been history there. And I've kind of, rested on the shoulders of some of the legends, ahead of me, such as Robert Nichol. He's been an amazing mentor to me. He's the first Olympic sports pharmacist, and I coined him his own name, Mark. I call him the godfather of sports pharmacy.
Amen.
Yeah.
Hey, the road's got to get paved or at least put into gravel, right?
Yeah. And, to say the least, man, so sports and athletics have always been in my DNA from youth.
Mm-hmm. And it's amazing to hear in this case, somebody taking what matters to them, what figuring out what that root is, and then channeling it as a pharmacist. It's going where few, almost none, but few have gone before, and that's often student pharmacists. Oh, good golly, the proverbial P1 year experience is all schools got some kind of either career roundtable or panel or whatever, and everybody always thinks as a student pharmacist, it's I'm going to figure out what are my options, what am I going to do? I want to do what that guy did. I want to do what that lady did, and in the end, it's like, yeah, what you want to do probably doesn't even exist yet. So go get it done, like you have. So it's amazing to hear, we'll say your story there of the history of where you've been, what you've got going on there. So pretty cool. So, all right. So in this sports pharmacy realm, so what are some of the most frequent sports pharmacy, patient athlete scenarios where us pharmacists with the proper specialized training, of course, can help out?
Yeah, so great question. So, helping athletes navigate anti-doping regulations by ensuring their medications and supplements comply with the World Anti-Doping Agency or even the United States Anti-Doping Agency or any other governing bodies list. And so, for example, and this could be very complex, right? And so, you have the NCAA, which has their own banned substance list. And so if you're working with a college player who's in the NCAA, while there is the USADA and the WADA banned substance lists, which are more higher end banned substance constituent organizations, it's important to make sure that whatever team that you're working with, you're able to advise for that specific governing body. Same thing with professional sports. So when you think of NHL and NFL, they have their own banned substance lists. And so it's important for, the sports pharmacists to stay up to date with those things, is because, we want to protect the health and safety of our athletes. And even if they are, for example, taking a banned substance, and the most common one I see is stimulants, right? Mm-hmm. Making sure they have what's called a therapeutic use exception report, which pretty much means, hey, like this player, they're taking it for a medical reason. There's a medical necessity behind it. They've been diagnosed with it. And that paperwork, you have to make sure it's it's submitted to the governing body. And, I've seen many cases, Mark, where, even though a player was prescribed, Adderall, if that paperwork isn't filled out and they're taking it for the right reasons, they still can be subject to suspension.
Ouch. That could be right. The old paperwork trail. That's
exactly. So, that's where the sports pharmacist role can really play a part. Some other good scenarios is advising on appropriate analgesics. So we're on the pain podcast, right? Mm-hmm. So, pain management is a huge disease state in the athletic realm. And so typically, being able to tap into your clinical and kinetic skills can be key. You have, for example, like indomethacin, which is a very potent anti-inflammatory. Why would you choose that one over an ibuprofen? Or, for example, like a Celebrex, which targets more COX-2, right, which has less of the GI side effects. And so, being able to understand the differences between which NSAID you would use for a specific athlete is important. Muscle relaxants, the same thing. Would you give somebody a cyclobenzaprine in the middle of the day, an athlete? No, it's because all of a sudden you're probably going to see a drop in their performance.
I mean, if they want to take a nap, maybe.
Right. maybe you'll give them a methylcarbamol, right, which is less sedating. And so when you're thinking about, okay, what are some good sports pharmacy patient case scenarios, you really have to tap into, the safety, efficacy, and the potential performance implications these medications or supplements can have.
Absolutely. That, gosh, you brought up the idea of just medication selection, our wonderful heavy hitters with quote unquote muscle relaxants. I got an age old pain pod episode where we dive into that. It's the island of misfit medications, a la the good old, Rudolph the Red-Nosed Reindeer holiday show with the island of misfit toys. It's like, they're all something else disguised as what we say muscle relaxant. You mentioned methocarbamol. It's like that thing's OTC in Canada. Like,
right.
That's a lot different than a cyclobenzaprine that's nap juice for men.
Right.
You give that to a guy or gal in the middle of a game, and the end of the game is going to be a dream. It might still end well, but it's not going to be in reality. So those things come into play, and it's in the patient perspective, patient athlete, and the rest of the clinical team, they need that there. An athletic trainer is very well trained, but might not know all the nuances between the different muscle relaxants, as you articulated, of course, too. So it's, that the NSAIDs, that opens up a whole can of worms there too, of course, right? It's like, well, there's so many, and it's, I have sat, I did a pain pod episode on those, of course, too, back in the day. But the big picture is I've sat through so many different conversations, clinically and random, and presentations at so many different conferences too. And it's like we spend all this time going through the pharmacological nuances, and then push comes to shove. Which one do you choose? Like you mentioned indomethacin, and there, gosh, I got the pain pod episode on my kidney stone of the, ketorolac, that the not going to be your average thing you're utilizing on a field, of course, and then all the topicals. Like the first question always is which one, and then how much and how do you go about it and all that stuff. But I'm sure that you get your fair share of those, right? Like that's.
All the time, and this is why when I have pharmacists or even students that are still going through their pharmacy school curriculum, they ask me, what are some good prerequisites that I should take in order to be well qualified for a sports pharmacist position. I always tell them it starts with being a good steward as a pharmacist and understanding the kinetics of how drugs work, is because if you're being asked these questions, what's the difference between, a Celebrex versus an indomethacin, or a Toradol, versus a diclofenac? Oftentimes it's going to come down to, what are the clinical pearls? What's the side effect profile? What's the peak analgesic effect? And, I tell you, Mark, all this stuff I learned, and I had to kind of pull back out my old pharmacy school books and relearn kinetics, is because it can be very complex. But because I'm always tasked with being the drug expert, and being able to educate, my team about the differences between all the different NSAIDs or anti-inflammatories out there, is hallmark and key. So.
Absolutely. It's, what you mentioned there is just huge. The, you mentioned like, hey, going back and looking at, what you were taught back in the day. And it's like, we could probably even extrapolate back to undergrad years. Everybody's always done, OChem lab, all the different chemistries along the way. And it's like, boy, if we were only able to learn it in a way that we were able to, have it illustrate of how it directly affects your career, you're automatically more interested in it and learn more. Like,
absolutely.
Like I have an elective I teach on substance use, or we basically spend a good number of hours going over illegal drugs. And I'm not saying, I'm not insinuating that we should be in undergrad labs teaching people how to make meth, but like, that's the extreme. Pick any other scenario, and it's like you'd get people paying attention a lot more, right? And then that when you have that touch to it, like how you've tied things into sports and athletics and patient athletes overall. All of a sudden, it's like it matters more. So you want to learn more along the way, and it's like reteaching it to yourself and everything like that too. So it's and of course keeping up with all the different particular, not necessarily generalized, but specialized conferences and things like that, all the trainings that are out there. So that's big. Yeah. Back to the NSAID idea, there's so many nuances of it's like, how do you pick the right one? What's your go-to? Relatively recently on LinkedIn. I know you're a fan. You certainly have a presence there as well too. It kicks off a lot for all of us of, sharing that knowledge as a pharmacist out there with the world. But I had asked, hey, what's everybody's go-to opioid? Oh my goodness, I felt like I put daggers into people's kidneys or something. Like, well, it's patient-centric, and true, amen, yes,
Yeah,
it is. 30-year-old healthy individual got nothing going on. Which one you using because their back hurts? Like what? We don't need the 3-page case with all the labs all the time. Like what is a go-to? Like, and we encounter that. I'm sure you do for NSAID selection along the way as well too, of like there's so many different things that go into it, like what's the actual condition and situation got going on. Big picture, is it acute care, chronic care? With patient athletes, you're going to have those that have chronic pain, and certainly those that experience acute pain, and it could be acute on chronic along the way too. But for NSAIDs, it's the cardio versus GI. You mentioned celecoxib, so on and so forth. It's like so many folks view that as like, oh, well, you want it safer for the tummy. Well, what about the heart?
Yep. Because believe it or not, Mark, I mean, I'm starting to see cases, and I mean, this is a lower percentage, but I mean, I don't know if you ever heard of the condition hypertrophic cardiomyopathy, which pretty much means enlargement of the heart. And that is essentially a risk enhancing factor for a sudden cardiac arrest or death. And so when you have a young athlete like that as a good example, who may have that condition, and you're trying to go down the list of what anti-inflammatories to use, to your point, you don't want to choose the NSAID that has an increased risk for cardiovascular events.
Yeah, it's huge. I mean, that's huge. And it's, most guidelines out there are always kind of pushing towards that COX-2 selectivity side. Not a lot of times it's celecoxib, but not just that, even meloxicam, so on and so forth. And it's like, you got to balance that out. It's a teeter-totter. It's not just one or the other, of course, too. So,
yep.
And, in pain, it's like, hey, a lot of times we'll, conversationally say, well, folks aren't really worried about how frequently you have to dose it or things like that, but because it's like, well, you want to have your pain taken care of. But athletes are pretty busy, whether a weekend warrior or a professional. It does come into play, of course. And then, our folks in the pain realm, it's like, are they getting other procedures done too, where an NSAID would have to be discontinued for a day or a week or whatever? And it's like, I encounter that even in the pain management realm specifically of, okay, here's a pain medicine, but you have to not use it for like a week because you get in this other procedure that's going to help with your pain as well. And it's like, okay, all the patient hears is, I got to go a week with pain. How am I supposed to play pickleball? Like, trying to link them together here, but there's so many things that go into that. I know you mentioned a few of the go-tos, but in the end, it certainly depends on, hey, what's the patient got going on, right?
Yep.
That it probably leads us to the overall idea of like with topicals, because there's, diclofenac, obviously where it's at when it comes to prepared anyway, topical pain medications. But what kind of thoughts you got in that realm, I guess?
Believe it or not, I think questions around topicals is probably the one I get the most. It's because, it's the most accessible for a lot of the athletic trainers to choose between to help kind of, anesthetize any of the pain the athletes can be going through. And so, you have your Tiger Balm, you have your Tiger Balm. I mean, you have your BioFreeze, which is a very popular topical agent. You have your Wasabi Rub, right, which has a lot of great ingredients in there. But, it all comes down to, okay, how do you differentiate the different active ingredients, right? And so you'll have some topicals that have methyl salicylate, which kind of acts as a counter irritant, producing a warming sensation that distracts it from deeper pain. And because it's a derivative of salicylate or similar to aspirin, it has that mild analgesic and anti-inflammatory effect. And so, for example, if you're looking for, a topical to have that warming sensation effect, choosing one that has methyl salicylate could be a good option because that's going to help with the muscle soreness and stiffness. Now you see some athletic trainers go to menthol, which more releases that cooling sensation, right? And that provides a temporary analgesic effect, more of that pain numbing that reduces those nerve sensitivities inside of the peripheral nervous system. Some people, I notice a lot of baseball players. I mean, they'll soak their body in an atomic bomb, right, which is rich in capsaicin.
Mm-hmm. With a name like that, good going.
Yeah, especially with the baseball pitchers, right? They'll just lather their arm with atomic bomb. I mean, but the capsaicin, it's derived from chili peppers.
Yeah.
And so that causes that burning sensation, ultimately depleting substance P, which is a neurotransmitter involved in pain signaling. And the beautiful thing about the capsaicin is it provides a long-term desensitizing effect to reduce the nerve activity that we get from some of the pain. And, some of these topical agents, Mark, they have one of these ingredients. Some have two, some have three. And so for example, the Tiger Balm, I believe that has a combination of menthol and camphor. And camphor is another active ingredient that I may have forgot to mention, but this also serves as a counter irritant, stimulating those nerve endings and having a cooling / warming sensation similar to the menthol and methyl salicylate. And so, being able to differentiate between the different active ingredients is going to be key when you're selecting topicals, is because, as I mentioned or alluded to not too long ago, some have one of the ingredients, some have two, some have three of them. But I will say this, the ones that have three, kind of like the wasabi rub. The beautiful thing about that is you have this triple action effect, creating a longer duration of action with helping to calm down the pain. Versus like a BioFreeze only has one of those active ingredients, menthol 4%, which will only give you that cooling effect. And so they each have its role, but again, this is where the expertise of the clinical sports pharmacist comes into play, because these are drugs. You are the drug expert. It's just you're tailoring it to sports and athletics.
And it's overlaps with being an educator too. It's taking such, particularly with multiple ingredients. Anybody walking down a pharmacy aisle or a grocery store aisle, for that matter, looking at all the topical agents, it gets daunting really fast. And I love your approach.
Very overwhelming.
I fully endorse, and it's what I do as well too. Is like, let's just simplify it here. What are the ingredients? Because there's only so many. You can count them on two hands. It's just the the exponential combinations. Then all of a sudden, like a Tiger Balm. Well, which one? There's like a dozen different ones. It's gone are the days where you could say, oh, go get XYZ product. Well, which one?
Right.
And that it's comforting to know that, hey, even in the athletic realm, it's the same idea of just simplifying it to say, like, as far as counter irritants, be looking for warming or cooling or both, numbing or inflammation agents, so on and so forth along the way. Oh gosh, the stories that come with some of the ingredients, like I think you mentioned camphor towards the end there. It's like, supposedly that's also good for repelling mosquitoes. And it's like, hey, maybe that'll come into play for a baseball game if you're down by a river in the middle of a summer evening or something. I don't know.
You're right about
that.
Good
way to get somebody's respect when they're like, man, that guy knows the stuff. Jeez.
Yeah.
Anyways, I learned that if you put rosemary in campfires, it's said to keep mosquitoes away. I can't say, hey, that worked. I mean, it's not some kind of clinical trial or something, but lo and behold, that's what's in camphor. That's where camphor is coming from too. So
that's funny.
But, yeah. The
fun fact.
It gets pharmacy trivia only gets you so far, but hey, you're talking to a patient athlete, and that gets their attention. They don't want bug bites either. They're annoying. So, all right. So we were talking about topicals. Let me do a little fork in the road here. So, kind of counterintuitive to topical pain medications, controlled substances. So, you mentioned like even stimulants earlier, but controlled substance, the proverbial red flags or the scenarios where it's like, hey, where can somebody get in hot water? Not the tub after the game, but where would you say, like, do you observe those, scenarios overlapping with, sports pharmacy? Like where are, athletes in pain? Where are some scenarios that come up that like you could help them through and talk them through for, like for maybe one example is like traveling. It's, you're in a different geographic area or something. What have you seen in that realm?
Yeah, and it's very important to mention this, right? Pharmacists, they must be vigilant in identifying any potential concerns while ensuring the safe and effective use of pain management medications, is because sometimes athletes honestly don't know. The only thing they do know is that they're under pressure to perform, return to play, and sometimes that can interfere with the logic of not trying to abuse controlled substances. And so, one thing for me that I always check, especially if they're traveling, is the good old PDMP, prescription drug monitoring program. That dashboard was meant for a reason, to make sure even your normal patient is not abusing any opioids. I tend to check for any escalating or high dose opioid use. So athletes with like acute or chronic pain that may be prescribed opioids, especially after any type of orthopedic surgery. I look for any of those repeated escalations in dosing, early fill requests, or the most important thing, Mark, that I see sometime, which is unintentional, is the combination with other sedating agents like your hypnotics. Maybe they can also be on Ambien, right? Or Lunesta. They can also be on like neuropathic meds like a gabapentin. You never know. They may also be on a muscle relaxer. I mean, this is a recipe of disaster, and this kind of falls in the lines of a trilogy, right? And that puts them at an increased risk of substance abuse. Especially if they're using almost any of my guys who are on, chronic pain management for a long period of time. Narcan is something I always give, is because accidental overdose is a thing. And you know this probably better than I do, since you're an expert in this space. But it's important, again, protecting the health and safety of athletes is a huge part of our job. Right now,
those are wrong too. I mean, hey, it just because say one person on a team has chronic pain, they're utilizing a prescription opioid, maybe higher risk dose, and hey, you're on a bus still with everybody. What if something were to happen? And having things available like a naloxone or the opioid antagonists, of course, it's huge. It's conversations, and if anything, gosh, it shows you care, right?
Yes, yeah, no, it does. And the other thing is, like, I like to go into this with good intent, that people are using these medications judiciously, but every so often you have some bad players, right? And so it's important to make sure that some of these guys are not doctor shopping, right? Not seeing making sure that they're not getting an opioid from the doc in Florida, and then they're on the travel bus and getting a opioid prescription from the doc in Georgia, right? So, this is where, checking the PDMP database comes in at, not just the one in Florida where they may have gotten the original script, but also maybe calling, to one of the pharmacies in Georgia to have them check the PDMP system to make sure that there is no substance abuse. And then every so often, I will see some athletes turn to non-prescribed pain relievers, whether that's from an online source, from a teammate, or any type of alternative medicine. That's important too, to serve as a gatekeeper, so that whatever they're taking over the counter is not a violation of the banned substance lists.
Right.
And so that's another piece, that sometimes you may see, especially if these guys are traveling on the road and they're in very bad pain. But essentially, you being that last line of defense and you being able to save the athlete from, getting any type of sanctions or putting their health at risk in any means is important as a sports pharmacist.
Absolutely, and that's it's being there for folks. And at one of my go-tos for talking about in the clinical realm of, not Big Brother, but just double checking. Right. I usually show a picture if it's like a presentation or something of, somebody just hits a home run in a huge game. It's a playoff game. The stands are going wild. And the guy's trotting around the bases, gets the home plate. The whole team's there to greet him. It's a great time. And then you have the umpire that has to look only at the plate to make sure that the runner batter has his foot touch the plate. If it doesn't touch the plate, the home run doesn't count. So, and it's essential. Now, not everybody in every play likes an umpire, right? But, or any official in any game, but like it's essential. That's part of what we're there for is it's helping at all times, of course. So, all right, so go big picture here, really big picture. It's something I ask everybody basically, but Brandon, how do you define pain?
Good question. Pain is very subjective, right? I think it's a complex sensory and an emotional experience influenced by any type of tissue trauma, damage, inflammation, or any type of neurological dysfunction. And it can be nociceptive pain resulting from like a physical injury, neuropathic pain stemming from nerve damage, and in the sports pharmacy world, understanding these different pain mechanisms and pain descriptors really helps us guide evidence-based interventions, helping with the recovery of the athletes and also being able to mitigate any risk associated with prolonged use of medications or dependency.
Sounds good. It's sometimes the most straightforward questions are not the easiest, right? There's a lot going on. It's more than meets the eye.
It makes me think about when you go on interviews and they tell you the first question they always ask you is, "Tell me about yourself."
Yeah.
It's an easy question, but you can really go down a rabbit hole answering it.
Oh, yeah. The International Association for the Study of Pain, a couple years back, they just wanted to redefine it. And I'm like, everybody always wants to be in the room where it happens. I actually don't, because that would be a conversation amongst quote unquote experts even that would just go in so many circles that I'd get dizzy. And in the end, hey, whatever they say, it's not like it's the law of the land anyway. So, all right. So kind of piggybacking on that, the other thing I always ask guests, of course, here on the Pain Pod is, what's your favorite pain medication and why?
So I like, this it can depend on the situation, but just generally speaking, I like indomethacin. I know it's an old age drug and it does have
oldie but goodie.
Yes, I know it has the increased risk of GI effects. Some people may not be able to tolerate it well, but just thinking about the kinetics of it as far as its peak analgesic effect, its bioavailability. I think it just works. It works very well. And it's something that I've seen in my space with athletes taking it and them being able to kind of, nip the pain in the bud within the first 20, 30 minutes. That as far as oral, topicals, I really like the combination medications of like the methyl salicylate, the menthol, and the capsaicin is because of that three-way effect of it really, tackling the nociceptive pain and then also some of the nerve pain as well, with those three different active ingredients there. So I would say those two. Okay. Topical, I gave you guys a topical option and then also an oral.
I don't think anybody ever did the whole, well, hey, there's different formulations out there. So I can appreciate that, particularly in the realm of sports pharmacy. I mean, obviously, it's not a buy one, get one, but it's going to come into play even a little bit more so. Again, whether the weekend warriors, like you mentioned, or professional athletes, or, hey, everybody else in the middle too. So,
yeah.
Well, Brandon, I certainly want to thank you. I hope this was a good time here on the Pain Pod. But I have a feeling that you may have inspired not one, but multiple, if not many folks out there to, kind of take a little pause and think, hey, what do I want to do with my pharmacy career or life for that matter? Of the, maybe what I want to do doesn't exist yet. Or has been done by very few. And you're an inspiration to many in that realm. And I got to commend you there in that realm. But I certainly want to thank you for your time here and going through some of the big picture when it comes to sports pharmacy, but then also some of the getting more granular when we went into pain medications and the anti-doping rules overall, different organization, really giving a pretty good bandwidth to our listeners here in the Pain Pod. So thank you again, Brandon. It's been a pleasure. So.
You're welcome, and thanks for having me, Mark.
Absolutely. And, that's a wrap, Pain Pod Nation. I hope you enjoyed this chat. And, of course, join us next time on the Pain Pod.
If you'd like to join Mark on the Pain Pod, send us an email to publisher at pharmacypodcast.com. And make sure to share the show and subscribe on your favorite podcast directory. Thanks for listening.